Okay, alveoli. Simple squamous epithelial cells largely compose the walls. Alveolar pores connect neighboring air sacs. You have your pulmonary capillaries cover external surface of your alveoli. So you have your respiratory membrane. On one side of your membrane is air and on the other side is blood flowing past, formed by your alveolar and capillary walls. So gas crosses the respiratory membrane by diffusion. So oxygen enters the blood while carbon dioxide enters the alveoli. Okay. So alveolar macrophages, or what you call dust cells, it adds protection by picking up bacteria, carbon particles, and other debris. So for surfactant, it is a lipid molecule, coats exposed alveolar surfaces. It secretes a cuboidal surfactant or secreting cells. Okay, so the alveoli has three other significant figures. Number one, they are surrounded by a fine elastic fibers of the same type that surround the entire bronchial tree. Number two, open alveolar pores connecting adjacent alveoli to allow air pressure throughout the lungs to be equalized and provide alternate air routes to any alveoli whose bronchi have collapsed due to disease. Okay. Number three, remarkably efficient alveolar macrophages crawl freely along the internal alveolar surfaces. So although huge number of infections microorganisms are continuously carried into the alveoli, alveolar surfaces are usually sterile. So because the alveoli are dead ends, aged and dead macrophages must be prevented from accumulating in them. So most macrophages must be swept, okay, up by the ciliary current of superior regions and carried to the pharynx. Yun yung ginasabing cilia. So in this manner, we clear and swallow over 2 million alveolar macrophages per hour. Okay, next. Okay, let's go to your respiratory physiology. Do you have questions?
None so far po.
Okay. So, functions of the respiratory system, it supply the body with oxygen. It disposes your carbon dioxide. So, respiration includes ito na yung kanina, your pulmonary ventilation, external respiration, respiratory gas transport, and internal respiration. Okay. Guys, can you just give me a minute, ha? Mr. Blaze is asking something from me. Ma'am, can you please stop the recording muna? Thank you. Okay. So for events of respiration, you have your pulmonary ventilation. It is moving of air into and out of your lungs, commonly called your breathing. So you have your external respiration. You have your gas exchange between pulmonary blood and alveoli. So oxygen is loaded into the blood, and then carbon dioxide is unloaded from your blood. And your respiratory gas transport, it transports oxygen and carbon dioxide via your bloodstream. So you also have your internal respiration. It is a gas exchange between your blood and tissue cells in systemic capillaries. Okay. So pulmonary ventilation, it is a mechanical process that depends on volume changes in the thoracic cavity. So volume changes lead to pressure change, which lead to the flow of your gas to equalize pressure. So mainly, pulmonary ventilation consists of your inspiration and your expiration. It is a mechanical process that depends on the volume that changes in your thoracic cavity. So volume changes to lead pressure changes, and pressure changes lead to your flow of your gases to equalize your pressure. So this one, okay. So gases always fill their container. Consequently, in a large container, the molecules in the given amount of gas will be far apart of your pressure and will be low. Okay, I'll give you this diagram. Okay, so for inspiration, guys, you have two phases of pulmonary ventilation. So you have your inspiration or your inhalation. It is a flow of air into the lungs, while expiration is an or exhalation is the air leaving your lungs or gina-expire ni mo siya. So this inspiration or inhalation, the diaphragm and your external intercostal muscles, it contracts. So there is an intrapulmonary volume increase. So there will be a decrease in gas pressure. And then air flows into the lungs until pulmonary pressure equals atmospheric pressure. Okay. Ito na lang. So visualize the thoracic cavity as a gas-filled box with a single entrance at the top. So the tube-like trachea. So the volume of this box can be increased by enlarging all of its dimensions, thereby decrease the gas pressure inside it. This drop of pressure causes the air to rush into the box from the atmosphere because gases always flow down their pressure gradient. So this is what we are trying to say here. Gas intrapulmonary volume increases and also there will be a gas pressure decrease. Okay. So for inspiration, the action of your diaphragm, okay? The diaphragm contracts, it moves inferiorly and flattens out as a result of your superior inferior dimension or the height of your thoracic cavity increases. So, the action of your intercostal muscles while inspiration, when the external intercostal muscles contract, they lift the rib, okay, and pull the sternum superiorly. Okay, going on top because the ribs curve downward as well as forward around the chest wall. And the broadest lateral and anterior posterior dimensions of the rib cage are normally directed obliquely downward, but when the ribs are raised and drawn together, They swing outward, expanding the diameter of your thorax. So basically, the diameter of your thorax increases because of your expansion. Changes in anterior, posterior, and superior dimensions. Okay. So ribs are elevated as external intercostal contracts. So the external intercostal muscles, this one. So the diaphragm moves inferior during the contraction. So this is during your inspiration. The air gases flow into your lungs, getting inside of your lungs. Okay. So there will be what? Expansion of your rib. Okay. In full inspiration yan siya. Okay. So in this figure, okay, during expiration, inspiration muscles relaxes while the diaphragm rises, the rib cage descends due to recall of your costal cartilages, okay? Thoracic cavity volume decreases. Third, elastic lung recoil passively. Intrapulmonary volume decreases. Number 4, intrapulmonary pressure rises. Number 5, the air gases flows out of the lungs down to its pressure gradient until pulmonary pressure is zero. So there it is. Diaphragm moves superior as it relaxes. So this is your external intercostal muscles. Ribs are depressed as internal intercostal relaxes. Okay, so in expiration, the rib size is decreased. During inspiration, guide, the pressure or the atmospheric pressure is 1 to 0, okay? While expiration, it's gonna be 0 to +1 pressure. You have questions? Do you have questions? None so far?
None so far po.
Pa, ma'am.
Okay. Let's go to respiratory volume and capacities. Okay. So the factors affecting respiratory capacity, you have your size, your sex, your age, and physical condition. So you also have your tidal volume. So the normal quiet breathing, 500 ml of your air is moved in and out of your lungs with each breath. Wait. Okay. So the four respiratory volumes are tidal, inspiratory reserve, expiratory reserve, and your residual. During normal quiet breathing, about 500 ml of air moves into and out of your lungs with each breath. This respiratory volume is what you call your tidal volume or TV. So the amount of air that can be inspired forcibly beyond the tidal volume is 2,100 to 3,200 ml is the inspiratory reserve volume or your IRV. Okay. So the expiratory reserve volume or your ERV is the amount of air normally is 1,000 to 1,200 ml that can be expelled from the lungs after a normal tidal volume expiration. So even after the most strenuous expiration, about 1,200 ml of air remains into the lungs. So this is what we call your residual volume, which helps to keep the alveoli open and prevent lung collapse. Okay, again, what is your tidal volume?
500 ml po.
Okay, this is what you call your what? This is your
Normal
normal.
breathing.
Okay, how about your IRV? This is your tidal volume that can be forcibly inspired, okay, up to 2,100 to 3,200. So that's your inspiratory reserve volume or your IRV. When you say expiratory reserve volume or your ERV, it has an amount of 1,000 to 1,200, okay, that can be expelled from the lungs after a normal tidal expiration. Okay, so the residual volume RV is what? The remaining air in the lungs that will help your alveoli to open and prevent lung collapse. Okay. So you have your respiratory capacities. So when you say respiratory capacities, it includes your inspiratory, functional residual, your vital, and your total lung capacity. Okay. So the respiratory capacities always consist of two or more lung volumes, sorry. So for your IC or your inspiratory capacity, it is what you call your total amount of air that can be inspired after a normal tidal volume of expiration. So it is the sum of your total volume and your inspiratory reserve volume. Again, let me write that to you. Kasi nalibog na mo. Okay. So again, so you have your number two, you have your functional residual capacity or your FRC. It represents the amount of air remaining remaining in the lungs after a normal tidal volume expiration and is the combine of RV and your residual volume and your expiratory reserve volume. Okay. So vital capacity, you have your is the total amount of exchangeable air, sum of TV or your total tidal volume, sum of your inspiratory reserve volume, and your expiratory reserve volume. While your total lung capacity is your sum of all the lung volumes. Okay. Okay. So function volume test, that is the air that actually reaches the respiratory zone. So usually about 300 ml. Okay, so respiratory capacities are measured with your spirometer. Have you seen a spirometer?
No po, ma'am.
Not yet? Okay, let me check it for you. This one. So this is what we do if you're gonna test for pulmonary function. So the patient takes a deep breath and blows as hard as possible into the tube. Okay, so you have to close or you clip your nose. And then there's a technician or pulmonary nurse, okay, that monitors the patient on how to do the test. Okay, so this is the machine that will record. Okay, that's it. Okay, this is what we're trying to talk about kanina. So we have these legends 0 to 6,000. Okay, so this is your residual volume up to 1,200, the green one. And then that's so 1,200 up to what? 2,500. That's your respiratory reserve volume. So that makes like 1,200 ml pa rin. So this area here is your tidal volume, which is your normal breathing, correct? Okay. Above that is your inspiratory reserve volume. Okay. So from this bracket, this is your vital capacity. Okay. And then this is your total lung capacity, the sum of all your volumes. TV. This is your TV. This is your ERC. This is your RV. And then this is your IRC.